Welcome. This tutorial has a dual objective: identifying the specific symptoms of asthma and mastering the mechanics of inhaler delivery. Throughout this session, please note the contact information for Dr. M.D. Ghulam Haider on the screen. Faulty inhaler technique leads directly to increased symptoms and more frequent urgent healthcare visits. To address this, we will demonstrate the correct protocols for two primary systems: the pressurized metered dose inhaler, or PMDI, used with a spacer, and the dry powder inhaler, or DPI. Ultimately, possessing the right medication is only effective if you have the physical skills to deliver it past the throat and into the lower airways during an active flare-up. To determine if a protocol should be initiated, we look for four primary symptoms: wheezing, shortness of breath, chest tightness, and a cough. The defining clinical characteristic of these symptoms is their variability. They fluctuate in intensity and occur at different intervals over time. These symptoms are triggered by exercise, exposure to cold air, or by viral infections, and typically peak late at night or in the early morning. It is important to contrast these signs with unrelated chest pain. Sharp, stabbing pain is highly unusual for asthma and should direct you toward alternative diagnoses. Correctly recognizing this variable pattern is the required first step before any inhaler protocol can be deployed effectively. When treatment is required, the PMDI, attached to a valved spacer, is the primary tool for medication delivery. Preparation is mandatory. Because these inhalers contain a suspension, you must shake the device vigorously immediately before use to ensure mixing. Follow the strict 1 puff and 30-second rules. Actuate only a single puff into the spacer at a time, and you must begin your inhalation immediately. Waiting longer than 30 seconds or spraying multiple puffs into the chamber causes the dose to fail, as the medication particles settle on the spacer walls instead of reaching the lungs. For a standard dose, the optimal maneuver is a single, very slow inhalation, followed by a sustained breath hold. However, if the patient is a child under 5 or an adult in severe distress, you must use an alternative method called tidal breathing. Tidal breathing involves taking 5 to 6 continuous, normal breaths in and out of the spacer for every single puff actuated. Physically verify the medication is moving by watching the spacer's one-way valve open and close with each breath. When using a face mask for young children, ensure a perfectly tight seal to prevent aerosolized medication from escaping and reaching the eyes. These slow breathing mechanics are the only proven way to bypass the throat and drive the medication deep into the airways. Dry powder inhalers require a physical technique that is the exact opposite of the PMDI protocol. This comparison shows the difference in airflow. While the PMDI requires a steady plateau, the DPI requires a sharp, deep, and forceful inhalation to pull the dry powder out of the device. Because of the force required, DPIs are generally not suitable for children under 5 or elderly patients with weak inspiratory flow. Maintenance of your equipment is equally important. Inside brand new plastic spacers, an invisible static charge causes medication particles to stick to the walls. To resolve this, wash the spacer in soapy detergent, but do not rinse it with water. Allowing the soapy water to air dry completely leaves a microscopic anti-static film inside the chamber. Removing this charge ensures the medication travels through the spacer as a clear delivery channel, rather than sticking to the hard plastic walls. We have now covered the core requirements for management: identifying variable symptom patterns and executing precise breathing mechanics. After using inhaled corticosteroids, always perform one final safety step: rinse your mouth and spit to prevent the development of oral thrush. Practice these techniques in front of a mirror and verify your form with your healthcare provider during your next visit. Precision in both recognizing the signs and executing the mechanics is the foundation for achieving long-term asthma control.